Good morning and welcome to the second part of the three-day webinar series titled Mind Care Matters, Securing and Safeguarding Teachers' Mental Health and Well-Being. This is a three-part webinar organized by the UST Arts and Letters Faculty Association, ALFA, in collaboration with the Office of the Dean and the Counselling and Career Office of the Faculty of Arts and Letters. Recalling yesterday, part one was titled Mind Your Mind. Dr. Dina Palmera Nadera, MD, tackled significant ways on how to value mental health. It introduced us to the understanding of the different types of hygiene, and with a focus, of course, on mental hygiene. To those who missed the part one yesterday, you don't have to worry. You can still access the entire program through our ALFA FB page and our ALFA YouTube channel. Please do not forget to subscribe. Click the button and subscribe, and of course, click the bell over there so that you will be notified every time we have our live broadcast. Talking about YouTube channel, all participants today are encouraged to comment and ask questions through your YouTube channel as well. In doing so, please, number one, state your name. Number two, the department you belong, and then you can type in your question, your comment, or any point or any matters that you want to share. So today, we will be tackling the we in the well-being, how we can support the well-being of others in trying times like this, and of course, beyond. It is what we call new normal. I know you are very eager to listen to our speaker today, but before that, allow me to introduce to you our speaker of the day. Renz Christian Argao is the International Youth Committee Coordinator, Chair of Religions for Peace, the world's largest and most represented multi-religious coalition, where he also serves as a member of the World Council and of the International Executive Committee. Renz is a registered psychologist and a registered psychometrician. He is the director and chief psychologist of the Argao Center for Psychological Services. An internationally recognized expert in traumatic stress, he is one of the handful of Filipinos who hold the status of a diplomate of the American Academy of Experts in Traumatic Stress. He is listed in the International Registry of Professionals, the International Deployment Directory, and the International Directory of Expert Witnesses of the National Center for Crisis Management, based in New York, USA. His work as clinical psychologist has been devoted to the psychosocial rehabilitation of communities affected by the armed conflict in the central Mindanao region and of communities affected by typhoons and natural disasters. He advocates for community-based mental health services and the integration of mental health programs in schools and workplaces. Apart from his clinical practice, Renz is also the co-founder and partner for learning and development of Smarter One Philippines, an online continuing professional development startup. He is also the national advisor of the Youth for Mental Health Coalition, the youth coordinator of Religions for Peace Philippines, and co-moderator ad interim of the Asia-Pacific Interfaith Youth Network. He is also one of the hosts of Walwal Sesh, the podcast. He was a former assistant professor of psychology at the University of Santo Tomas, and he has taught undergraduate and graduate courses in psychology at Far Eastern University, San Beda University, Angeles University Foundation, and has served psychology department chair or as psychology department chair of the College of the Holy Spirit, Manila. Renz has been a resource speaker of more than 100 seminars and workshops and training programs. Renz likes to travel, take photos, and read books. He collects die-cast airplane models and airplane boarding passes. Ladies and gentlemen, co-faculty members, and those who are watching us live via ALFA FB page and ALFA YouTube channel, it is my honor to present to you our resource speaker for day number 2 in the ALFA webinar series, Mr. Renz Christian Argao.
Thank you, sir, for that introduction, and good morning, everyone. Thank you for inviting me on
Hi, Sir Renz.
We're we're very thankful, no, that mental health is also being included in your webinars for our faculty members. So, allow me to share briefly during this morning what we know and what we can do on helping other people, no, especially when it comes to experiencing mental health concerns. So, I believe yesterday, Dr. Nadera already gave you a discussion on mental health. I believe that the discussion focused on ourselves, no, on how do we take care of our mental health, how do we ensure that we practice good mental health hygiene. Okay, so in this morning's discussion naman, we'll shift our focus into other people. Okay, so how do you support others? Especially during this pandemic, we've been hearing a lot of concerns, questions from individuals on how they can help their colleagues. Especially, we all transitioned into working from home, and a lot of pressure, a lot of stress was brought to many people because of that transition. So we have been seeing a lot of concerns. So some people were asking us, how do we help them? Okay, how do we reach out to them? Okay, from for our colleagues, for our students, okay, and even our family members and friends. Okay, so our discussion this morning would actually be focused on supporting your colleagues and your students, but you can also use these techniques to help other people like your friends and your family members. Okay, our discussion will be very practical. I tried to not be very technical po with the discussion today and focus more on something that we can actually do even if we are not mental health professionals. Okay, so there will be four key points, key areas that I'll be discussing this morning. We'll be discussing briefly again on mental health and mental illness. Dr. Nadera may have already given you an overview of this yesterday, so I'll just touch on it briefly. And then I'll discuss on how do we identify the signs when it comes to knowing that someone needs help. Okay. So in my discussion today, I will not be discussing specific symptoms of disorders. Iniiwasan na rin kasi natin, no, when we talk about mental health, we try to move away from the disorders diagnosis, no? Kasi ang nangyayari sometimes, nagsa-self-diagnose minsan yung mga participants, okay? Or they start diagnosing their friends or their family members, which may also lead to problems, okay? So in my discussion ngayon, what we will focus on is what are those indicators that someone needs help already, okay? Another reason why we do this is that sometimes kasi when we talk about the symptoms, some symptoms kasi of disorders, some behaviors included in those symptoms are actually normal behaviors then in certain circumstances. Okay, like for example, when we talk of anxiety, ngayon kasi, given the pandemic, no, given the crisis that we are going through, normal na magkaroon tayo ng anxiety. Okay, normal na maka-experience ka ng fears, ng worries, okay, which may also lead to difficulties in sleeping, difficulties in doing your work, no, yung productivity natin, and sometimes even yung appetite natin na apektuhan, tsaka yung relationships with other people. So, as these are normal given the current situation, we will be discussing how do we know when it's time to either encourage the person to seek help to other people or when we reach out to them to support them or to help them. So yun yung magiging focus po ng discussion natin on identifying the signs. Okay? And then yung pinaka-bulk ng discussion natin, yung pinaka-focus natin on how to help others, would focus on what we call mental health first aid. MHFA is actually a technique that is being used to help those individuals who may be developing mental health concerns, no, or who are already experiencing a psychological crisis. I'd like to be clear lang, no, because mental health first aid has a formal training that they do, which is actually several hours. And given na limited yung time natin today, this one is more of an overview of what MHFA is. Okay, just to get an idea on how it can be used. Kasi very practical din naman siya. Okay, but if you want to be formally trained, there's a separate training naman on how to do this. So, mas comprehensive yung discussion. And then lastly, yung part here on supporting someone in need, I focused it mostly on our students, but it could be applicable pa din on other people. No? Kasi these are very practical approaches na pwedeng gamitin and pwedeng i-apply naman for anyone. Okay, so let's start our discussion on mental health. Okay, so yun nga, yesterday you already had this discussion, but let me just touch on it ulit. Mental health is not just having happiness. Okay, it's not just having pleasure or satisfaction in the things that we're doing. Mental health actually covers our overall state of well-being. Okay, and when we talk about having good mental health, that means you are aware of your own abilities and you can use your own abilities, and you can reach your fullest potentials. Okay, you're able to cope with the normal stress of life. Okay, so yung mga daily difficulties na na-encounter natin, like for example, yung mga nagiging say struggle sa bahay, okay, or problem sa bahay, okay, or even yung sa work, no, in our lives, no, as academics, no, as educators, if you are of good mental health, nakakayanan nating i-handle yan. Okay, you can also be productive at work, you can contribute to your community, and at the same time, you are able to establish positive relationships. Okay, kaya lang, if we are of poor mental health, hindi natin nagagawa yung mga yon. Okay, particularly on the coping part. Okay, nahihirapan tayo to cope with the struggles, with the issues that we face on a day-to-day basis. Okay, so mental health is something, no, that's not just black and white. Hindi lang siya having good mental health or having mental illness. Okay, when we talk of mental health, we also try to look at it on the perspective na it is actually a continuum. Okay, it's a spectrum wherein it's something that ranges from having good mental health, and then on the other end naman is having mental illness. Okay, and in our lives, we vary in our position in this continuum. So there are days, there are moments in your life that you may be moving towards good mental health. While there might be instances naman that you might be moving naman towards the side of mental illness, o kaya pwede rin nasa gitna. Okay, you can vary in this continuum at different days, okay, or different moments, no. If you are stressed, halimbawa, lalo na kapag malapit na ang submission ng grades, okay, o kaya naman kung may accreditation at malapit na yung accreditation days, at sobrang stress natin, sometimes we might be moving towards, no, dun sa part na having poor mental health because of the stressor that we are experiencing. And there are those days naman, no, because of the different, say, accomplishments that we have, no, whenever we feel good about certain situations, or because of the support that we're getting from other people, we can be moving naman towards good mental health. So yung discussion, for example, ni Dr. Nadera kahapon regarding good mental health hygiene, no? Mental hygiene, that can help us move towards having good mental health. Okay? Kasi hindi rin ibig sabihin that you are of good mental health now, yun na yung lagi mong position in this continuum. Okay? So pwede ka pa ding mag-move dun sa other end pa rin. Okay? Or if you are on the end of mental illness, hindi naman na rin yun yung end. Okay? Parang you can still go towards having good mental health through support of other people and also through coping or adaptive mechanisms. No? So we have to remember this, no, we vary in this position, and we always say, no, that progress, no, when we talk about good mental health, is not just something that's linear na kapag okay ka ngayon, continuous na magiging okay ka. Okay, there really would be moments that you would also experience problems, and problems are normal part of our lives. Okay, and even some negative emotions like sadness, anxiety, or fear, normal din natin itong na-experience. Okay, and it should not always be assumed na dahil may anxiety ka ngayon, may mental illness ka na. Okay? Kasi it always depends on the context, on where the anxiety or when the anxiety is present. Okay, so yun nga, how do we recognize the signs? Okay, how do we know if someone needs help? Okay, and how do we know if we need to reach out to the person? Okay, or if we need to encourage naman the person to reach out to reach out for professional help, no, or to ask for help. Okay, again, I'd like to be clear lang po, these are not specific criteria or symptoms of a disorder. Okay, what we'll be discussing na signs are those things that could be observed on someone who may be experiencing a problem and who might already need help. Okay, so let's start with the emotional aspect. Okay, so on the emotional aspect of things, someone who may be experiencing, no, a mental health problem may be observed, no, as becoming more irritable. Okay, parang ang dali nilang magalit. Okay, they may snap, they may parang have issues in terms of anger management. Okay, o kaya biglang nagsusungit na, okay, na dati hindi naman siya masungit, pero ngayon parang may tinanong ka lang, nasusungitan ka na. Okay? Or nagbibigay lang siya ng instruction, tapos ang irritable ng way ng pagbibigay ng instruction. Okay? Or yun nga, parang lagi na siyang nangaaway, no? Lagi na lang siyang galit, kahit wala namang dapat ikagalit. Okay? Another naman is sensitivity to criticism. Okay? Yung tipong dati, okay naman siya whenever you talk to them about giving feedback, for example. Okay? Especially pagdating sa colleagues natin. Halimbawa, nagbigay ka lang ng feedback regarding their work. Okay? Tapos biglang they took it negatively. Okay? Or parang they felt na walang kwenta yung ginawa nila, or that they're not worthless. Okay? Or that they're not fit to the work that they're doing. Okay? So, and then titingnan dito yung parang dati okay lang naman sa kanila, no? Dati natatanggap naman nila yung criticism, tapos biglang ngayon ayaw na nila, or nahihirapan na sila in taking that. Okay? Another is they demonstrate an uncharacteristic loss of confidence. Okay? Yung parang dati kapag nagpe-present naman siya, kapag kausap mo siya, very confident naman, no? Parang may kumpiyansa naman siya sa sarili niya, pero biglang nawalan ng kumpiyansa sa sarili. Okay? Tipong may sinubmit siyang trabaho niya, halimbawa, tapos sinasabi niya na may problema yung ginawa niya, or hindi siya masaya dun sa nagawa niya, okay? Or feeling niya mali yung ginawa niya. Okay? Kahit na wala namang mali dun sa ginagawa niya. Okay? And then there's also that possibility, no, that they lose their sense of humor. Okay? Yung tipong nagtatawanan na kayo lahat sa group, halimbawa, tapos siya parang hindi nakakasabay. Okay? Tapos parang nagagalit, no, kapag nagtatawanan yung ibang tao. Okay? Or even jokes. Okay? Yung mga jokes na dating nakakaya naman niyang i-take, ngayon parang hirap na siya, no? Napipikod na sila dun sa mga jokes na yon. Okay? Take note, no, na whenever we talk about this pala, lagi natin tinitingnan yung sudden changes. Okay? Hindi dahil present yan, automatic naman na may problem yung person. We need to look at sudden changes in behaviors. Okay? Kaya nga kanina, no, when I was explaining them, I was mentioning na dati, hindi naman siya ganyan. Okay? Pero ngayon, ito na yung pinapakita niyang behaviors. Okay? So, that's on the emotional aspect. No? On the cognitive aspect naman, okay, the way that we think, okay, they're more likely to make more mistakes than usual. Okay, so in terms of their work, okay, parang lagi nang may mga lapses. Okay, ngayon we've been parang hearing complaints kasi we work with companies kasi we've been hearing complaints from the management, no, na yung mga empleyado daw nagsa-start ng magkaroon ng negligence kay pagdating sa duties nila, sa trabaho nila. Okay, and that may not be because tamad sila, okay, or that it's connected to some disciplinary concerns, but it might be because of their mental health concerns. Okay, so mas marami ng mistakes, okay, maraming lapses, okay. There might be problems in decision making. Okay, so may problem na sa judgment, may problem sa insight, okay, which is also usually connected dun sa inability nila to concentrate. Okay, because their mind is filled with different emotions, with different thoughts. Sometimes the focus is also lost. Okay, kaya for example, nagmi-meeting kayo, parang wala siya sa present siya during the meeting, pero their mind might be drifting somewhere else, no? And then yan, also because of the difficulties in concentrating, nagkakaroon na rin ng drop sa productivity or their performance. So, and usually these are unexplainable, no? In a sense na parang wala namang nangyari sa workplace. Okay? Wala namang nangyari dun sa trabaho niya, sa mga ginagawa niya, walang changes in terms of workload, pero biglang bumaba yung performance or yung productivity niya. Okay? So that's the cognitive part. No? Kung titignan natin kasi when we talk of mental health concerns, no, they don't just affect kasi our emotions. No? What people, some people think is that when you have a mental health problem, it's all about feelings. Okay, it's all about feeling sad, for example, or feeling afraid. Okay, and it's not that you're happy. Ibig sabihin, you're of good mental health now. No, we try to parang not limit lang yung mental health in happiness kasi, no, because mental health is really encompassing our well-being, no. Kaya pati yung thoughts natin, the way that we think, no, the way that we perceive, and the way that we even expect from others, naapektuhan din ng mental health natin. So it's important also, no, to look into these things para makita natin na hindi lang siya about feelings, about emotions. Okay, behaviorally naman, no, in terms of how we act, one of the things that you could see, for example, parang sa work, no, nagiging late na sila palagi. Okay? Or sa class, no, late na sila sa class or sa meetings. Okay? Kaya naman nag-absent. Okay? Or sometimes parang hindi na sila nagpapahinga. Okay? Nag-overwork na. Okay? Kaya naman nag-aawal, di pumapasok, na an official time off. Or in terms of social relationships, hindi na sila nag-socialize. Okay? Hindi na nakikihalubilo. Okay? Yung usual na usapan, for example, at chismisan natin sa faculty room, hindi na sila sumasama. Okay? They may be parang isolating themselves. Okay? O kaya naman in terms of parang outside work, no? Hindi na sila nakikipag-chat, hindi na nakikipag-usap, okay? Hindi na masyadong lumalabas ng kwarto, for example. So, which is unusual from their normal, no, na dating nakiki-interact naman sila. Okay? So that's behavioral. Okay, and then in terms naman ng physical or somatic, no, or bodily changes because of mental illness or mental health concerns, mas constant na yung pagkakaroon ng illness, no? There is a link kasi between our mental health and our physical health. Okay, whenever we are stressed, humihina din yung ating immune system. Okay, research have shown already, for example, that experiencing chronic stress, chronic depression, and anxiety may actually increase the chances of having or the risk of having any form of cancer. Okay, kasi nga yung naapektuhan din ng mental health natin, yung physical health natin. So, because humihina yung immune system, mas prone tayong magkasakit. Kaya papansin nyo din, no, if whenever you are stressed, mas madali tayo magkasipon, okay, or other physical symptoms, no, nafe-feel din natin. And sometimes, kahit hindi yan caused by other biological factors, minsan nakakaramdam tayo ng physical symptoms because of our own mental health din. Okay? They may look tired. Okay? Makikita mo sa mukha nila that parang they're exhausted. Okay? Even unkempt, no? Yung appearance nila, okay, parang hindi na nakakapagsuklay, okay, or sa hygiene magkakaroon ng changes, okay? Parang hindi na naliligo, okay, na dati naman naliligo sila araw-araw, for example. Okay, ngayon parang wala silang energy para gawin 'yon, okay? Or sudden weight changes, okay? Kasi usually nakaka-changes din yan ng appetite, okay? So sometimes either biglang pumapayat, okay, or bigla namang nagigain ng weight, okay? Now, if you've observed any of these signs, okay, if you said yes dun sa question kanina, take note lang din, again, I've mentioned this kanina, spotting one or two of these symptoms does not always mean naman that there's an underlying mental health issue. Okay? Hindi naman automatic. Kaya nga, we've been trying to move away from yung mga symptoms, no? Kasi minsan nag-over-pathologize tayo. Okay? When we say over-pathologize, parang may nakita ka lang na slight problem, iniisip mo na kagad na it's already equivalent to a disorder, for example, no? So I always try to see things pa din na posible kasing normal naman yan. Okay? So, but okay, if you did see any of these signs, it might be already a good indicator, no, to check on the well-being of others then. Okay? Just to see how they are doing, how they are feeling, and of course, to reach out to them and to let them know that there is support available then. Okay? Because when someone is going through an emotional crisis, ang importante talaga na matanggap nila also, no, from other people is that emotional support that they could get. Okay? Let me just show you this part wherein we compare yung what depression feels like for someone who may be going through depression, and on the other side naman, how it may be seen, like for example, from their coworkers. Okay, depression kasi it's not just sadness. Okay, it's not just feeling sad. It may be something that would really affect the person's way of functioning. Okay, and dealing with other people. So kung titignan niyo yung dun sa side ng what depression feels like, it includes, no, deep feelings of sadness, okay? And how can that be seen by other people, or how it would look like to other people? It could be in the form of withdrawal, no? Or isolating themselves, okay? Kasi nga, the feeling of sadness, or sometimes kasama niyan yung feeling ng loneliness, okay? It could include a loss of interest in their daily activities. So, posible yan na mag-lead ng indifference. Okay? Yung parang wala na silang pakialam dun sa mga nangyayari. Okay? Kaya ngayon, even yung kanilang hygiene na apektuhan, yung kanilang other functions, hindi na nila nagagawa kasi parang wala na silang pakialam because they don't have the energy, no? You may see this also with some of your children, for example, if you're a parent, no? A few days ago lang, I had this parent come to us asking for help kasi ang anak nila, nakikita na nila na may problem, okay? Tapos the parents kasi does not believe in mental health, no? They don't believe in mental illness. So when I was discussing to them what their child was going through, biglang sabi ng parent na nagkakaroon lang daw yan ng depression kasi napapagalitan siya kasi ang tamad-tamad daw ng anak niya. Okay? So hindi daw niya ginagawa yung mga chores sa bahay or even yung online classes, so hindi daw siya nag-a-attend. Tapos napapagalitan siya because of that. No? Kasi syempre as parents, you would also have to correct yung mga behaviors ng anak nila. But in reality, no, the child was not able to do those chores kasi wala siyang interest, walang energy to do those things because they're already experiencing depression. Okay? Pero ang nakikita ng magulang is that it's a problem ng behavior, it's a problem ng discipline. Okay? And I had to explain to them na hindi yung pinapagalitan siya yung reason kung bakit depressed siya. Okay? Yung depression, yung reason kung bakit nagkakaroon ng problem dun sa mga ginagawa nila. Okay? Yung hindi nila magawa. Okay? It may also, again, binanggit natin kanina, difficulty concentrating or having slower thoughts. Okay? So sometimes they put things off. Okay? Nagpo-procrastinate sila. They may have missed deadlines. Okay? Yun nga, yung sa trabaho natin. Okay? Or even accidents. Okay? Kasi parang dahil nga hindi sila makafocus, nagkakaroon ng safety issues. Okay? Halimbawa, tumatawid siya ng street. No? Tapos since yung isip niya lutang, no? May malalang iniisip, hindi niya mapapansin, no, yung dinadaanan niya, and that could lead to accidents then. Okay? It could also cause forgetfulness, no? Kasi nga because of the different emotions, thoughts that are already in their mind, it may affect also their other normal day-to-day thoughts. Okay? So they may appear scattered, okay? Sabog, kumbaga in Filipino, or sabaw, no? Or even absent-minded. Okay? Na parang kapag kausap mo siya, ang layo ng sagot, okay? Or hindi agad nagre-respond. Okay? It could feel also like troubles, no, in making decisions. So yun nga, for other people, they may see that as procrastination, being indecisive, okay? Or parang nagiging dependent din on other people, na parang hindi sila makapag-decide for themselves, okay? You have to ask other people for help on making decisions, okay? Or yun nga, slowed productivity din, okay? Kagaya kanina dun sa because of the difficulty in concentrating. Okay, it could also have symptoms of difficulty in sleeping. Okay, depression is often connected to insomnia, but now we've been seeing then other people having yung opposite, no, yung hypersomnia or sleeping too much naman. Okay, so hindi naman dahil tamad yung anak mo kaya siya tulog ng tulog. Okay, or some parents, so yung kagaya ng parent na kausap namin no isang araw, nagpupuyat daw kasi lagi yung anak niya. Okay, kaya daw nagkakaroon ng ganyang depression yung anak niya. But in reality, no, it's a depression that causes the difficulty in sleeping. No? Hindi sa nagpupuyat yung bata, but because they're having difficulty sleeping, so they try to find other means, no, para makatulog sila. Okay? Or yun nga, sleeping too much naman. Kasi parang ang nangyayari, the sleep offers a form of an escape for the person. Okay? So, of course, because either nahirapan silang makatulog or they slept too much, that could equal naman, no, to being late to work, okay, or late to their classes, okay? O kaya in the afternoon, that they could experience afternoon fatigue or daytime sleepiness, okay? And also, again, since kulang yung tulog, that can also lead to accidents. And also, physically naman, on the health aspect, pwede rin siyang magkaroon ng problem, syempre, kasi humihina, of course, ang immune system din natin. Okay? And then, depression also includes feelings kasi of worthlessness, okay? Or feelings of parang feeling nila hopeless na rin sila, no? O kaya parang inappropriate yung mga ginagawa nila. Okay? So, doon nanggagaling yung parang lack of confidence, okay? They're unsure already of their abilities, and because they have parang a lower, poorer view of themselves, nakaka-affect na rin yun sa performance nila. Okay? So, yun, binanggit natin kanina, irritability, anger, or fearfulness, okay? Tearfulness, sorry, which may lead also to inappropriate reactions, okay? So, yun nga, dahil parang lagi na lang siyang masungit, laging galit, irritable, it could also affect yung relationships, okay? Lalo na kapag hindi naman na-explain, no? Yung nararamdaman nila. Sometimes kasi the irritability and the anger, parang nagiging, ano yan parang superficial emotion siya na pangtakip dun sa mga other emotions ng person, okay? Dahil hindi mo naiintindihan yung nararamdaman mo, dahil naguguluhan ka dun sa feelings mo or sa dami ng nararamdaman mong feelings. Ang nangyayari, dahil nila mailabas yon, pagkausap nila ibang tao, yung irritability, yung mas nagmamanifest sa kanila. Okay? And then, yun, weight or appetite changes, okay, which may affect also the appearance of the individual. So, if you look at this comparison, no, iba kasi yung nararamdaman ng person with depression at dun sa nakikita ng iba. Okay? And for most instances kasi, lalo na no, if it involves our students or even yung mga subordinates natin, sometimes that seems more like parang behavioral issues or disciplinary concerns when they could actually be mental health concerns na pala, no? Naapektuhan na lang yung mga ginagawa nila, trabaho nila, or even relationships with other people. Okay? So let's now talk about how you can help others. Okay, how can you help your colleagues? Okay, again, this mental health first aid discussion is more of an overview. Okay, although nakalagay dito, it's supporting your colleagues. The technique can also be used for other people. Okay, pag sinabi nating first aid, okay, actually in the psychological first aids, no, there are several different types. Okay, meron tayong tinatawag na psychological first aid, which is an approach that we use whenever we are helping individuals who may have been through a crisis. Okay, naka-experience sila ng traumatic event, o kaya ng, like for example, yung calamity, accidents, okay, sudden death, okay, yun yung PFA yung ginagamit natin. Okay, there's also suicide first aid, okay, or SFA, which is a technique naman that we use to help those individuals who are or who have suicidal ideations or even who are attempting suicide. Okay? And then mental health first aid, ito naman ginagamit to help, parang ang term na ginagamit natin minsan, to address yung mga day-to-day concerns or everyday problems that people may be experiencing. Okay? So, mental health first aid is actually the help that we give to a person or provide to a person who may be developing a mental health problem, okay, or they may be experiencing already a mental health crisis. Okay, so we often say that this is given until professional help is received by the individual, okay, or until the crisis is resolved. Okay, kagaya po ng physical first aid, ng medical first aid, di ba? Bago nasugatan ka, what you do is you clean the wound and then you apply, say for example, parang ointment, no, or betadine halimbawa, and then you bandage it, okay, to make sure na hindi lumala or ma-infect yung sugat. Okay, same sa first aid na mental health, ganun din ang ginagawa niya. It tries to initially provide the support to the person. Okay? Pero it's not the be-all and all. Okay? Hindi naman dahil nag-provide ka ng mental health first aid, ibig sabihin, okay na yung person. Okay? We're just trying to parang mitigate, no, the possibility that it would become worse. Okay? And if it does become worse, dun naman papasok yung professional help. Okay? Kagaya rin yun, medical nga, di ba? Kung nasugatan ka, naglagay ka, ginawa mo yung first aid, tapos na-infect pa din, pupunta ka pa din ng hospital, okay, for you to get treated. In the psychological aspect, in the mental health aspect, kung nagkaroon pa din ng problem yung person, then that's the time that we recommend them for professional help, okay? So, mental health first aid is also aiming, no, to preserve life, okay, especially when the person is a danger to themselves, okay? Like when they are experiencing or having suicidal thoughts, o kaya naman when dahil nga yung lack of focus, lack of concentration, may risk na, no, dahil yung ginagawa nila, pwede na silang masaktan nila yung sarili nila or mapahamak sila. O kaya it could also be to preserve life when they are a threat to others, okay? Kasi may ganong circumstances din. Mental health first aid also aims to provide help, Okay? Especially to prevent the concern, the problem from becoming more serious. Okay? So bago pa siya maging disorder, for example, okay? Tinutulungan na natin yung person. Mas maganda kasi yung prevention, okay, compared to in the sense na parang mas mabigat yung value ng prevention kaysa sa intervention. Okay? Kasi minsan pag napabayaan yan, mas mahihirapan tayo in intervention. So it's really important to put more effort on prevention then. Okay? Mental health first aid also aims to promote recovery of good mental health and also to provide comfort to the person. Okay, so we always say pa rin na, of course, that professional help would still be better, no? Kasi that could promote really good recovery. But in the absence of professional help, mental health first aid already provides that support needed to promote recovery. Okay, so mental health first aid is something that's usually offered by someone who's not a mental health professional. So this one does not require licenses as psychologists or psychometricians or guidance counselors or a psychiatrist. Okay, it can be done by someone who is in the person's social network. So it can be your friend, family, or colleagues. Okay, or even someone who is working in a human service occupation. So like teachers, okay, faculty members, okay, or responders, okay, like police officers, employment agency workers, or even disability workers. Okay. Um, Again, its aim is to provide immediate support. Okay, but it does not aim to make a diagnosis. Okay, so when you do MHFA, hindi po yan way of doing a diagnosis. Okay, yun nga, no, ang risk kasi, kaya ako minsan iiwasan ko nagdi-discuss ng symptoms. Ang risk kasi minsan, dahil aware ka dun sa symptoms, tas nakita mo dun sa isang tao, sinasabi mo na kagad na, uy, may anxiety disorder ka or may depressive disorder ka or may ganitong condition ka kasi present sa'yo yung symptoms. Okay? So when we do MHFA, we do not make that diagnosis. Okay? We also do not do this to prove no a diagnosis. Okay? Kasi minsan lalapit sa'yo yung friend mo, sabi niya, uy, feeling ko may depression ako kasi ito yung symptoms ko. Okay? Tapos nung kinausap mo siya, sabi mo, ay, oo nga, mukhang may depression ka kasi gano'n. Okay? So that's not the goal also of MHFA. No? At the same time, yun nga, it does not provide treatment. Okay? It's just a first aid. Pangunang lunas lang siya, hindi siya yung gamot, kumbaga. No? It's not a treatment, it's not the actual intervention to parang deal with the problem or the issue itself. Okay, it's really just helping address the immediate concerns of the person. Okay, so why provide MHFA? There's a stigma associated already with mental health problems. Okay, so masyadong negative po ang view pa rin on mental illness. Many people still don't believe, no? And I'm still encountering a lot of those people na they deny mental illness. Okay, o kaya naman sa ating mga Pinoy, no? Pag nakita mo kasi yung mental health or usapang mental, no? Yung word lang na mental, ang nangyayari na kagad, niisip baliw. Okay? So, hindi po ganun. No? Hindi dahil meron kang depression, hindi dahil may anxiety ka, ibig sabihin baliw ka na. Okay? These are illnesses. There are still conditions no? Na pwedeng gumaling at pwedeng matreat as long as you provide the necessary interventions. Okay? And some people who have mental health problems may not also be aware. No? They may not have the insight of what they're experiencing. Okay? They may not know that what they're feeling, yung pagiging irritable nila, for example, they may not be aware no, na it's connected to their emotions. No? Baka iniisip nila, ibang tao lang kasi may problema or na dahilan kung bakit sila nagiging irritable, but it could actually be internal. No? Or sometimes, yung ibang tao pa, nakakakita na may problema sila. Another is that professional help is not always available. Ito po, medyo kulang kaming mga psychologists. Okay? We have a ratio of 1:100,000. One psychologist to 100,000 Filipinos. But I think that's even a bit larger. No? Kasi konti lang kaming licensed. But for clinical psychologists, mas malaki yung gap. Kasi po, hindi lahat ng licensed psychologists are clinicians. Okay? So, mas konti kaming clinicians. So, it's very difficult to reach out. No? And even psychiatrists, I think ang ratio ng psychiatrists ngayon is also one psychiatrist to 200,000 na ata, no? Kasi sobrang konti din po. Okay? And of course, research-wise, mental health first aid has been found to be effective. Okay? So it's been found to be a good approach no, to help others. Okay? So if we look at the spectrum no, of interventions, kung titignan natin yung continuum kanina, no? If you are well and becoming if you are well, no, before we develop a problem, yung prevention, yung ginagawa natin. Okay? Kung nagsisimula tayo magka-problema, if we start to become unwell, or if we are already unwell, no, early intervention naman yung nakakatulong sa atin. Okay, so in these instances, dito papasok yung MHFA. Okay, dito tayo pwedeng makatulong. Okay, and then if the person is already unwell, kung meron na siyang problema, or they're starting to recover, dun pumapasok yung treatment. Okay? So sa prevention, these are the programs that are targeted for everyone. Okay? Kagaya ng ginagawa nyo ngayon, no? Because of this ALFA webinar series is a form of prevention in a sense. Okay? Kasi this includes trainings, okay? Educational campaigns, okay? Awareness campaigns, and even learning how to take good care of ourselves. Okay? Those are prevention programs. And this should be available to everyone. Okay? Early intervention naman are those programs that we provide and that we give, no, to address those who are already starting to show their problems, their concerns. Okay, this one hindi na lahat binibigyan nito, yun na lang mga nagsisimulang magpakita ng concerns. Okay, in the workplace, no, the mental health law now requires employers to make sure that they provide the support to their employees, okay, in terms of their mental health concerns. Okay, and then of course yung last naman yung specialized area na, which is the treatment. Okay, this is now focused on those individuals who already have mental health problems. Take note lang, no, that there is no one size fits all in terms of treatments, no, for mental illness. Okay, it's always looked at a biopsychosocial perspective. It's a combination of different issues, reasons on why the problem developed. So dun din tayo nanggagaling in terms of how we will be dealing with the concerns. Okay, so mental health first aid actually has 5 action plans. Okay, ang shorter version nito is the acronym na ALG. Okay, so A stands for approach. Okay, so this is where we approach the person. L is to listen non-judgmentally. G is to give support, information, and reassurance. And then yung dalawang E are both encouraging support. Ang difference, yung una, encouraging professional help. And then the other one is encouraging self-help and other support naman. Okay, so let's go into the details. Okay, so first action plan, yung approach the person. Okay, this is whether you start to reach out to the person and ask them if they have a concern or a problem that you can help with. Okay, or if someone comes to you and asks you for help, this is where you approach them. We connect to them. Okay, so assess, no, identify if there's any crisis present. Okay, and then assist the person in dealing with them. So when we talk of crisis here, the possible crisis that a person can experience include being a harm to themselves. Okay, kanya kung meron na silang mga suicidal ideations, or because of their difficulty in focusing, medyo at risk na sila of harming themselves or injuring themselves. Okay, it could also be when they are experiencing extreme distress. Okay, so pwedeng wala namang harm or walang threat sa sarili nila, pero sila mismo nadi-distress na. Okay, hindi na sila okay dun sa nararamdaman nila. Okay, they're not okay with the sadness, they're not okay with their anxiety. Okay, or they're not okay na hindi sila nakakaligo or nakakakain, for example. Okay, or their behavior is already disturbing to others. Okay, yun nga. Some people kasi are not really aware that their behavior is problematic. Okay, and other people may be the one who observes that. Okay, now if the person doesn't have a concern naman that is a crisis, then you can ask them how they're feeling, okay, and how long they have been feeling that way. Okay, then we move to the next step. Okay, so dito it's really kumbaga ang pinakasimpleng sabihin dito is how are you feeling? Okay, or okay ka lang ba? Okay, or kumusta? Kumusta is already actually a good way to approach the person, no? Mamaya I'll be giving another parang way pa of doing this in another slide then. Okay, but basically when we approach the person, we start that connection. Okay, kasi whenever someone is experiencing a mental health problem, one of the good things that would also be helpful apart from listening to them is connecting to them. Okay, providing that support and letting the person know that they're not alone. Okay. And then, the second action is listening non-judgmentally. Okay, of course, tinanong mo na siya, ano ba yung nangyayari? Okay, you try to identify what the problem is. So, remember to listen. Okay, and we always say that listening is a very important action. Okay, I often get asked, no, pag ano ba yung dapat sabihin kapag may lumapit sa'yo at nagtanong ng tulong o humingi ng tulong, okay? Ano ba yung correct words to say, okay? And I always say there is really no correct words, okay? Walang formula na kapag ito yung sinabi sa'yo nung friend mo, ng family mo na may problema ako, ito yung dapat mong sabihin kaagad, okay? Kasi there's really no parang exact formula to help a person feel better. Okay, it always depends on what's going on. And if you don't know what to say, I often say, makinig ka lang. Okay, that's the most important thing that you can do and the help that you can provide to the person. Okay, and make sure when you're listening, set aside any judgments. Okay, lalo na kung yung taong yan, yung problema niya parang paulit-ulit na lang. Okay, lalo yung mga friends natin, di ba, minsan kung say relationship related yan, sometimes we already have a judgment kasi about the person. So pag lumapit sila sa atin, parang may idea na tayo kung bakit sila may problema. Tapos, nakaka-apekto yun, no, when we listen to them, especially when we also express the judgments that we have on the person. Okay? So, be aware also of your verbal and non-verbal listening skills. No? Ako, ang lagi ko din sinasabi, make sure that you hear and understand what is being said. Okay? And also what is not being said. Okay? Mahalaga kasi na hindi lang yung sinasabi ng tao yung pakikinggan natin, pero ano ba yung mga bagay na baka hindi niya nakakayang sabihin pa. Okay? So it's important to make it easier for the person to feel that they can talk to you freely. Kaya tinatanggal natin yung judgment natin. Okay? Kasi kapag nauna na yung judgment, minsan, lumapit sa'yo yung tao, no? Lumapit sa'yo yung kaibigan mo, katrabaho mo, humingi ng tulong, tapos sinabi mo na kagad, ay, naku, wala lang yung problema mong yan. Okay? Pakasimpleng problema lang yan. They might feel invalidated. Okay? They might feel na parang, ay, hindi naman siya interesadong makinig sa akin. So, hindi na ako mag-open up ng problema. Okay? Or if yung mga anak nyo, no? Kung lumapit sa inyo, nagsabi na, ma, nahihirapan na ako sa school, tapos sinabihan mo na kagad na, ay, naku, matalino ka, kakayanin mo yan. Okay? So, in the future, whenever they have problems, they may not feel parang comfortable talking to you kasi there would always be that feeling na, ay, baka ma-dismiss lang tong concern ko. No? So, every time that someone talks to you and tells you their problem, kahit may judgment ka on that person, makinig ka lang muna. Okay? If you want to talk about your own parang judgment or gusto mong pangaralan yung person, do that when their emotions are already stable. Okay? Not on the time na unstable pa sila, no? Or nagsasabi pa sila ng concern nila. Okay? And then, after hearing their concerns, okay, then that's the third part. Give support and information, okay? So this can be through emotional support, okay? Importante that we empathize, of course, on how the person feels, okay? And give them that hope with regards to recovery, okay? Another help that you can provide is through practical help, okay? These are on those tasks, no? That may be overwhelming already. Okay? Syempre, na pag lumapit, for example, yung katrabaho mo, okay? Tapos sabi niya, nasa-start na akong ma-depress kasi, or nasa-stress na rin ako kasi nag-aaway kami ng asawa ko, sabi niya sa'yo. Tapos because of that, no, because of the stress na pinagdadaanan niya, hindi niya nagagawa yung mga trabaho niya, for example. Okay? Hindi na niya magawa mag-check ng papel. Okay? Hindi na niya magawang magbasa ng mga requirements ng mga bata. Okay? Or hindi na niya magawang mag-submit, no, ng mga kailangan i-submit sa work. Okay? So, you can ask them if there's anything that you can help them with, no, dun sa mga task nila. Kasi obviously, hindi naman natin talaga masosolve yung away nilang mag-asawa halimbawa, but there's something that you can do, no, to help them on the things that they can manage. Okay? Pero it doesn't mean naman nagagawin mo na yung trabaho niya para sa kanila. No? It means helping them lang, no? Guiding them in simple ways that you can help them. Okay? On practical approaches that you can help them. Okay? And lastly, information is important. So, importante na bigyan natin sila ng information on what mental health problems are and what, to correct misconceptions. Okay? Hindi ibig sabihin, inform them, no? Hindi ibig sabihin na nade-depress ka, baliw ka na. Okay? Hindi rin ibig sabihin na nag-seek ka ng help sa psychologist, may sira ka na, halimbawa, no? Because we can always ask for help with mental health professionals, okay? Even if we are of good mental health. Okay? Di ba nga, nagpupunta ka ng dentist kahit na for cleaning, no? Kahit wala namang sira yung ngipin mo. Okay? Kaya nagpapa-annual physical exam tayo just to make sure, to keep our physical health in check. Ganun din naman sa mental health. No? You can do that also to parang keep your mental health in check din naman. Okay? And then, Encourage support, yung sa action 4. This one focuses on encouraging them to seek help from professionals. Kaya lalo na if alam yung kailangan na nila or if their concern is something na hindi mo din naman ma-address kasi it's already something that requires professional help. So, provide them the options. Kaya let them know ano ba yung available support. Okay, like for example sa work, no? Sa UST ba halimbawa, saan sila pwedeng lumapit? Okay? To ask for professional help. Okay? O kaya naman kung sa iba, no, sa outside the university, for example, what options are available? Okay, like they could go to a psychiatrist, they could go to a psychologist. Okay, in order for them to get the support that they need. Okay, and yun nga, remember, there's a higher chance of recovery when professional help is given. Okay, kaya very important yon. Okay, and then Action 5 is to encourage naman other forms of support, okay? Particularly yung self-help strategies, okay? Like what you've discussed kahapon, for example. Those are very important, no? In ensuring that they are also able to cope and adapt to the problem, okay? And then yung support, of course, from family, friends, and also other people, okay? So let them know that there are other people who are also willing to help them, okay? So that's the actions, no, that are being used to help others following the mental health first aid. Okay. Now, in doing this, let me share with you some techniques lang, no, that you can use that. Okay. Some basic techniques in psychosocial care. So this includes 6 things: no? Ventilation, empathy, active listening, providing social support, externalizing interest, and also relaxation or recreation, or the value of relaxation and recreation. Okay, so ventilation, this is really just allowing someone to talk about their feelings. Okay, so when someone comes to you, just allow them to express those emotions. Okay, because someone with a mental health concern may be experiencing suppressed or restricted emotions. Okay, it's not that they don't want to talk about their emotions. Sometimes kasi they're not aware. Okay, hindi nila ma-describe. Okay, hindi nila maintindihan yung nararamdaman nila. Okay, because there's too much emotions, ang hirap sabihin ano yung nararamdaman nila. Okay, o kaya naman minsan because of the many emotions that they're feeling, nagna-numb yung emotions nila. So parang wala silang nararamdaman. Okay, so hindi nila ma-express. Okay, so when emotions build up, they need to express that. Okay, some may do, some may not need to express, but ventilation is actually a very good way to help out the feelings. Okay, so when someone reaches out to you, it's important to allow them to simply talk about what they're feeling, what they're experiencing, and what they are thinking. Okay, so this releases already the emotions and the feelings of the person. Kumbaga, pag napupuno ka na, di ba, kailangan mo rin namang ilabas. Okay, para hindi ka sumabog. Okay, kailangan yun, no, yung ventilation. Kaya listening is really very important. Okay, so to allow ventilation, you can listen carefully and attentively. Okay, if you're talking face to face, make sure that you maintain eye contact. Although ngayon kasi, syempre, na because of the pandemic, puro online tayo, ang usually nire-recommend ko dito, kung may kausap ka, tignan mo yung camera ng laptop mo or ng phone mo or yung webcam mo. Okay? Look into the lens para yung kausap mo, pag tinignan ka niya sa screen, parang nakatingin ka sa kanya. Okay? It establishes that connection. No? Then, of course, make sure to acknowledge distress. Okay? Let the person know that you do see that you understand or that you hear the things that they're telling, no? The problems that they may be experiencing. So let them be aware that they're hurt. Okay? Kasi sometimes, pag hindi nila nafe-feel na napapakinggan sila, nagiging problem din yon. Okay? So, make sure lang that they feel na naririnig sila. Okay? At na nakikinig ka. Okay? Do not interrupt. Okay, kaya ventilation siya kasi pag nagsasabi yung person, pakinggan mo lang. Okay? Huwag mong pigilan. Unless na lang, of course, there's confusion or maggulo na yung kwento. No? Hayaan mo lang siya magsalita. Okay? And never ask them to stop crying. Okay? Ang tendency nating mga Pinoy kasi, di ba, pag umiiyak yung isang tao, ang sasabihin natin kagad, tahan na. Okay? Or huwag ka nang umiyak. Okay? Or tumigil ka nang umiyak. Okay, that's actually wrong kasi it prevents the ventilation or the expression of emotion. So kung umiyak siya, hayaan mo lang siyang umiyak, no? And of course, do not be judgmental. Okay, like what we mentioned kanina. Okay. In ventilation, physical touch is also helpful, no? Pero be careful, syempre, no? With regards to cultural factors, cultural concerns, no? lalo na kung estudyante mo yan, okay, hindi mo pwedeng basta-basta hawakan, or kung katrabaho mo din, no, kasi pwede kang makasuhan pa din ng sexual harassment. So, of course, kung family, at least mas madali, no? But if it's other people that are not family members, usually what we recommend is at least let the person know na you're going to touch them. Okay, so whether ask for permission or let them know na I'm going to touch you because I'd like to parang provide this support by touch. Okay, ang note lang natin, no, kasi ang tendency natin, di ba, pag hinahagod mo yung likod ng taong umiiyak, di ba, usually hahagurin natin yan. Tapos pag hinahagod mo, minsan ang sinasabi mo, o tahan na. Okay, that's actually wrong din. No? Again, huwag mong sabihin yung word na tahan na. At the same time, yung paghagod sa likod, pagpat sa likod kasi, that encourages yung pag-iyak. Okay, so kung hinahagod mo siya, it's like telling the person it's okay to cry. Okay, and it is really okay to cry. Okay, kahit po tayong mga matatanda na it's okay. Kung kailangan mong umiyak, ilabas yung emotions mo. That's perfectly normal. Okay. Then again, empathy, no? That's putting yourself on the perspective of the other person and trying to see what they're going through. Okay. Sympathy kasi is just parang expressing, no, your parang you feel sorry about the person based from your own perspective. Okay. But in empathy, we put ourselves in the position of the person. Okay. And then active listening naman, this is again, binanggit ko kanina, no, the most important thing that we need to do. Okay, it's the core of psychosocial care, and it's very important, pero sobrang hirap gawin. Okay, kasi ang nangyayari minsan, we listen, di ba? They often say, we listen to respond, not to understand. Okay, pero in active listening, we need to listen so that we understand what the person is going through. Okay, when you're listening, you again respond occasionally. Okay, acknowledge what the person is feeling. Okay, let them know that you take them seriously and that you understand them. So, minsan parang i-clarify mo yung sinasabi niya, no, that would also know if the person is going through some concerns. Okay, and then be accepting. Okay, like we said kanina, do not judge the person and also be clear on boundaries. No, don't try to know what the person needs from you. Okay, kasi minsan, di ba, may lumapit sa'yo tapos nagtatanong ng concern, tapos bigay ka kagad ng advice. Okay, so pag may lumapit sa'yo at naghumingi ng tulong, let them know, ask them then, parang, ano yung gusto mong tulong from me? Okay, gusto mo lang ba ng makikinig or do you need someone to give you an advice? Okay, kasi there are people na kapag nagtanong sila or nagsabi sila ng problem nila, gusto lang nila na may makikinig. Okay, and sometimes advices, no, may not really be welcome at minsan nakakadagdag pa sa problema nila. Okay. Again, social support is very important. You can do this in simple ways like eating together, okay, sabay kayo umuwi, or giving affirmations to one another. That already provides comfort na on the person. Okay. And then sa interest naman, no, this one for our colleagues, no, especially if you're a supervisor, a department chair, or an administrator, it's important to engage employees in activities, no, that are connected to their interests. Okay, that would help distract them. And that's also very important in a sense na it helps them focus, and then nakakatulong din na maka-recover sila kasi yung movement, no, that creates the routines, that creates the parang it creates a mindset, no, na they have something to look forward to, so that gives them the hope, no, na pwede nilang gamitin. Okay, and then there's also, of course, the value of relaxation. So encourage recreational activities, no, that can promote faster recovery, like wellness activities. So yung mga diniscuss nyo kahapon, yung mga pinag-usapan nyo kahapon, for example, sa mental hygiene, no, o kaya even others, simple things na pwedeng gawin for wellness. Okay, and make sure that you take the lead din, no. Do not be the problem, no. Promote relaxation in a way na kayo mismo pinapakita nyo, no, na like for example yung emails. Okay, this one lagi namin sinasabi to na hangga't maaari i-limit natin yung emails natin sa work hours, no, or at least during the daytime. There are some of us kasi na minsan tatrabaho pa ng gabi, di ba? Tapos mag-send ka ng email. Pwede po nating i-schedule yung email natin. Okay, kung may naisip ka at kailangan mo na i-type yon para hindi mawala, kung nagtatrabaho ka ng late night, don't click the send button. Okay? Click mo yung arrow down dun sa gilid ng send, then click schedule send, and then set it na ma-send na work hours na. Okay, that way, yung mga katrabaho natin at yung tatanggap ng email, pag na-receive nila yon, at least daytime na, no? Hindi yung nagpapahinga na sila, which also sometimes causes stress sa kanila. No? So, make sure that we also take this lead. No? We respect other people's needs for recreation and relaxation then. Okay? If you're an administrator, importante na you introduce the power down hour. Okay, step away from your emails, for example, yun nga, or quality time. No, recommend na ensure yung work-life balance. Okay, or you can also talk about the what we call the Pomodoro technique. No, sa work-life balance ito ginagamit natin yung Pomodoro technique, which balances yung trabaho natin and also yung personal time. Okay, if you haven't heard of this before, it's more of time management po. Okay, it's a time management technique, but something that you can do and you can use pa din naman even no with what we do. So ito yung Pomodoro technique, no, if you're not yet familiar. Although sa atin, syempre, when we're teaching, kasi may class schedules tayo, this may not be effective. But you can do this outside, no, yung work hours natin. So, the Pomodoro technique includes planning your task. Ilan yung Pomodoro na kailangan? Pomodori, yung plural niya. So, list the things that you need to do. Tapos, start your timer. Okay, yung Pomodoro is actually Italian for tomato, which is the shape of the timer kasi nung nag-develop nitong technique. So, 1 Pomodoro is equivalent to 25 minutes of work. So, set your timer. Tapos, continue working lang for that 25 minutes. Okay, and then take a 5-minute break. Okay, dapat break talaga siya, no? And then after 4 Pomodoro, then take a longer break. Okay, so which is about 20 to 30 minutes naman. So this is one technique then that you can use and you can do para ma-manage din yung time natin. Okay, so that's focus on helping others. No? Now let's briefly to discuss lang how do we deal with students in distress. Mabilis lang to kasi may 3 bagay lang na kailangan yung gawin. Okay, see something, say something, do something. Okay, so pag tinandaan mo to, see, say, do, okay, mas madali nang malaman how we address this. Okay, so sa C part, okay, so again, pay attention to the warning signs. Okay, yung mga binanggit natin kanina. As teachers, no, we are the first to see that as naging fellow student yan, to see someone in distress, a student in distress, or even fellow workers in distress. No, and again, mental health concerns have impact on our everyday lives, okay, including academic. So kaya kahit yung pagbagsak ng student sa mga yung bumababa yung grades niya, no, it could have an effect because of their mental health concerns. Okay, so ask yourself, what did I see? Ano yung na-observe ko? Ano yung narinig ko? Okay, at ilang beses ko na ito na-observe? Okay, and then reflect. Okay, is this something that bothers me? Ako lagi kong sinasabi, if your conversation with your student led you to feel distressed or bothered, then that would be a good indicator that you need to do something. Okay, so the next step, say something. Okay, so trust your instincts. I always say na you need to reach out to the person. So say something if you're worried about a student or if they leave you feeling concerned. Okay. Yun nga, if you're bothered. No? And remember, it's okay to share your concern about the student to someone else in the university. Okay. Especially our guidance counselors. Okay. Lagi po yung nandyan. Okay. Mga guidance counselors natin na nakakatrabaho ko yan lagi. Minsan niloloko ko sa kanila na sa kanila rin kasi talaga yung bagsak na ng students natin kapag kailangan na ng tulong. So, talk to your counselors then, or even other faculty members, no, who might be able to help the student. Okay, and then do something. This is when you reach out. Okay, sometimes the student may not know if there's help available, or they might hesitate to ask for it. Okay, so connect them to the resources, to the counseling office, for example. Okay, and then of course respond as you also feel appropriate. Okay, and then how do you talk to them? Okay, again, this part practical lang po, parang techniques lang siya, hindi lang sa students but also to other people. Okay, so the first part would be to acknowledge. Okay, last na ako, no? Medyo lumagpas na ako sa oras ko, sorry. But the first part is to acknowledge. Okay, it's really being specific about what you notice. Yung mga binanggit nating signs kanina. Okay, and then express your concern. Okay, importante yung expressing concern. Bakit? Kasi kapag, lalo pag students natin, no? Pag sinabi mo lang sa student na lagi kang late, okay, they would feel that they're being attacked. Okay, or kahit katrabaho mo yan, no? Pag sabi mo sa lagi kang late, lagi kang absent. Okay, and because they feel they're being attacked, they will just defend themselves. Okay, they will not talk to you about their concern. Kaya importante that you tell them that I noticed na absent ka. Okay, lagi. Okay, and I'm worried about you. Kaya ito yung script niya, no? I have noticed that you've been absent from class lately and I'm concerned about you. Okay, pag narinig mo kasi yung concern, parang okay, tinatanong niya ako kung bakit ako absent kasi may concern siya sa akin. Kaya hindi dahil galit siya sa akin. Okay, so importante 'yon. Importante na we express that concern. Okay, so the next part is an inquiring and listen. Okay, so ask open-ended questions. Okay, be patient. Again, listen carefully, listen attentively, and do not judge. Okay, so ito yung parang script niya. No, how is everything? Okay, are you okay? Okay, so kumusta? Yun nga, no? Tanong mo siya, oy, napansin ko lagi ka nahihirapan ka mag-submit ng requirements. Okay, nag-worry na ako sa iyo. Okay ka lang ba? Okay, that could be as simple as that, no? And then the third is providing the information. Okay, then we provide them resources and encourage them to contact, for example, the guidance office. Okay, so I'm concerned about you. I'd like to support you. So ito, you can talk to our guidance counselor. No, so you can go to them to their office. Open naman yan, available yan anytime. So talk to them. Okay. Excuse. By telling them that could also give them the idea na okay, pwede pala akong lumapit to ask for help. Okay. And then follow up pa rin. Okay. Advice, again, the counselor. Okay. Meron pong mga referral slips yung mga guidance counselors natin. So you can ask them for the pink form na pwede nyong fill upan to recommend someone who might be needing help. No? Then of course, check on the student then. Okay. Ask them kung kumusta sila, pero do not insist on knowing what they have done. Okay, huwag mo namang parang pilitin na, nagpunta ka na ba sa guidance counselor? Okay, it's more of asking them how they are doing. So, yun lang, kahit na how are things since our talk last week. No? So, yun yung 4 different steps to take no, when talking to a student in distress. So, ayun yung parang script niya. No? Quickly lang on things to remember. Again, accept and acknowledge. Nabanggit ko naman po ito kanina ulit. I'll just wrap up on this. Remember to focus on what is manageable, help identify resources, trust your insights, and syempre speak privately. Okay? Wag naman yung parang nasa Zoom class kayo or nasa Blackboard collaborate kayo tapos biglang dun mo tinanong yung student anong problema niya. Baka hindi yan mag-open up. Okay? So, mas maganda one-on-one. Okay? Make sure to respect the person, whether student mo yan, colleague mo yan, family member, even if you don't agree. Okay? Listen at that time. Yun yung pinaka-important. Okay? Be direct. Okay? Be clear with what you're saying. Huwag na magpaligoy-ligoy kasi minsan, when we're not clear, mas nagkikreate ng confusion yan. Okay? Again, actively listen. Be clear about your limits. Okay? Be clear na ito lang yung kaya kong ibigay na tulong sa'yo. Okay? And of course, yun nga, refer when hindi na natin kaya. Okay? Avoid judgment, avoid diagnosing, avoid preaching, okay? Or again, minimizing, patronizing. Preaching, yung pinapagalitan mo, pinapangaralan mo na siya at that time. Again, okay lang yun, lalo na kung magulang ka, but do that outside, no? Pag stable ng emotions niya at kapag mas ma-appreciate na niya yung sinasabi mo, okay? Again, do not minimize, wag maliitin yung problema at wag din silang bulahin. Okay. Siyempre, do not make any promises that you cannot keep. No? Huwag natin sabihin na parang, sige, akong bahala. So, isosolve ko yung problem mo na yan. Kung di naman natin kontrolado yung situation. Di ba? Don't overstep your boundaries then. Okay. Never force help din po. No? Sometimes, there are some people who may not want to be helped. So, if they do tell you na parang, okay lang ako, I don't need your help, wag naman tayong magalit sa kanila. No? So, we just let them know pa din na if they would need our help, they could reach out to us. Okay? Don't compare yourself in your experiences. And syempre, yung pinaka-importante, wag naman nating pagchismisan yung tao. No? Lalo na kapag co-faculty natin nag-open up sa'yo, wag mo namang i-chismis na sa ibang tao. Okay? Keep it private pa din. Okay? And this is my last, if I'm not mistaken. Remember that yung principle sa medicine to that we also apply, make sure that you do no further harm. Okay? If the person is already going through some difficulties, wag na nating dagdagan. Kaya yung binanggit ko kanina, don't be part of the problem. Okay, wag tayo yung maging dahilan. Minsan kasi tayo yung toxic, di natin alam, no? Tayo pala yung dahilan kung bakit na hindi okay yung tao. So, make sure that we are also aware of our own emotions, feelings, okay? Para hindi tayo nakakapekto sa ibang tao. Okay? And I leave you lang with this question. This is something you've talked about yesterday. But I'd like to always ask you then to take care of yourself. Okay, so ask yourself, how do you take care of yourself? Okay, kasi when we don't take care of ourselves, that could lead to us, no, being the problem to other people. Ayun. So, sorry, sumobra yata ako sa time na napadami yung daldal ko today. But I hope you learned something from me. I try to be very practical po with our approaches para mas magamit natin siya, no, sa araw-araw nating buhay. So, maraming salamat po. Again, thank you, Alpha, for inviting me in this webinar. And thank you also for listening in this discussion. So, yun, medyo lumagpas lang po ako sa time natin, but I think we still have enough time naman for the Q&A. So again, thank you. Ibalik ko na po sa ating moderator.
Wow, a round of applause. Thank you so much, Sir Renz. I've learned a lot and we have lots of questions here for you. I hope we will not do overtime this time. Okay, so let's start off with our first question from Sir Nico Tarayo of the English Department. Since the country's mental health bill encourages mental health initiatives in the workplace, do you think most Philippine schools have been prepared to do such?
My dissertation po kasi now focuses on looking at the mental health services provided in schools. And so far, and I'll be very honest and frank in saying no, many schools are not ready. Many schools do not have the necessary services that are provided, not just to their students, but also to the employees. There are very few institutions. No? UP, for example, has services that they provide both to students and their faculty members and their staff. Sa atin sa UST, sadly, sorry for being too frank, hindi tayo ganun ka-ready. Kulang pa po, no? Sa students, our Counseling and Career Center, hands up ako dyan kasi they really have enough support for our students. But as you know, faculty members, wala, and support staff, wala pa hong malinaw. No? We've been pushing for that even before I left UST. That's something that we've been working on. Sadly, our proposals have been left in the pipeline. Hindi pa po nagagawa. So it's very important that we really also address this. Our counselors are there for students, and I know a lot of them have been helping faculty members. The psychotrauma clinic is there to help also staff and faculty members, pero hindi pa po yun sapat. And many schools are not yet ready. So yes, it's a call for the admin. Gawan po sana natin ang paraan. That could be the simplest answer that I could give to that.
And there is actually a follow-up question, sir. What do you think are the factors that impede these initiatives?
Okay, medyo nag-share na ako ng results ng dissertation ko. One major factor is administration. Really, if I look, whenever I ask them parang what are the reasons bakit hindi natin ito ma-provide, it's really lack of support from the admin. Yun nga, no, I personally encountered that na in some instances wherein we were pushing for some services na hindi kayang suportahan kasi hindi nakikita yung need, no? To the point that at one time I told an administrator na anong data po ba yung kailangan? They're asking us for data to support that. At ang sabi ko, ano po bang data kailangan natin? How many dead bodies do we need to give you for us to promote mental health services? No, that's number one. Support from the administration is very much important kasi kailangan po yan ng resources, no? When I did the benchmarking for mental health services for schools, the University of British Columbia has actually 2.5 million Canadian dollars per year for student mental health lang. Okay? That's 100 million pesos. Mas malaki pa sa budget ng buong Pilipinas on mental health. So ang tanong sa atin, sa UST ba, magkano ang binibigay natin for mental health services ng faculty and students? Okay, that's a good question. That's one factor, no? Pangalawa, systemic na yun. Yung again, stigma connected to mental illness, so, kailangan din natin yung awareness. So, what you're doing, Alpha, is really sobrang thankful kasi kailangan po nating erase yung awareness. Kailangan nating maintindihan that mental health is as important as physical health. So, yun yung pangalawang importanteng, I think, i-limit ko dun sa dalawang yun. It's really administration support and then addressing the stigma on mental health.
Okay. Biglang, wow. Okay. Dr. Jim Sanchez Aguas, our president of ALFA, sometimes other people appear to be in a good state of well-being. We cannot see any sign of emotional or psychological problem or crisis until something tragic happens. How can we deal with this?
Mm-hmm. Actually, this is very good, no, Dr. Aguas, kasi there are people na tinatawag nating high-functioning, pero they have, for example, we call them high-functioning depression, yung condition, no? Wherein, although they are experiencing depression, maganda yung productivity, no? Yun nga, kasi they even tend to overwork, no? In those instances kasi, ang mahirap is to make them aware na may problema. Or sometimes di kasi natin nakikita yung problem, no? So, importante when we feel that this person, parang alam natin may problema kasi sa bahay or alam natin may problema sa, say, sa workplace, no? The important part is on the preventive. So, let them know and provide the safe space for them to open up. Kasi minsan, kaya rin sila hindi makapagsalita, no? Kasi they feel na walang makikinig sa kanila. So, by creating that atmosphere, that parang space, na it's okay to talk about your feelings, it's okay to talk about what you're going through, that would be a lot easier, no? It would be a lot easier for us to talk to other people about our problem. So, and then yun, baka dun na magsimula na matulungan natin sila. So, kung hindi sila nagsasabi or hindi naman obvious yung problem, preventive po tayo pagka ganun. Okay, so this webinar series by ALFA is already one of those important parang techniques, no, approaches that we can do to also help people, lalo na yung mga hindi sila aware na may problem sila.
Okay, from an anonymous person from the English department, convincing oneself to open up and share with a support group is relatively challenging. How does one develop openness in a mental health support group?
Mm-hmm. Okay. Actually, ang hirap po kasi ng openness kasi it doesn't just parang end on yourself eh. Malaking factor yung other people, di ba? If you know that other people are not willing to listen to you, it would really be difficult to open up. Okay? Kaya importante for us to make sure that we create that safe, positive space. No? But if you are someone who knows na you need help, okay, and you'd like to open up to someone, what we normally say or what we usually suggest is that you start with those people that you trust. Okay? Yung sure ka na pag ito nilapitan ko, makikinig siya sa akin. Okay? Kasi remember that there are those people who would be willing to listen. Remember that it's okay to ask for help. It's okay to let people know that you're not okay. Okay, or that you're going through a problem. Kasi when we start reaching out to those na alam nating makikinig at susuporta sa atin, malaking tulong na po yun. Okay, it could start that feeling na okay lang palang lumapit. Okay, sometimes you just have to take that first difficult step, no, of reaching out to others. So again, start with someone that you trust. Okay, or minsan naman, no, sometimes kasi alam mo na ay lahat ng kaibigan ko, yung family ko, they will not really be willing to listen to me. So sometimes talking to a stranger naman might be helpful, no? So whether it's a professionals yan, okay, or it could be other people that you could express your feelings to, no? So of course better if it's a professional para at least magabayan tayo, no? So reach out to them, okay, by first thinking and believing na it's okay, no? Knowing, reminding yourself that it's okay to ask for help, it's okay to not be okay, sabi nga natin, no, na lagi nating sinasabi, and know that help is always available. Kung lahat ng nakapalibot sa'yo, alam mong mga toxic yan, mga negative yan, or sila lang yung dadagdag sa problema, then don't go to them. Okay? Kasi sila talagang, dadagdagan lang nila yung stress mo. Go to those people that you know would be willing to listen to you, those that you trust talaga. Okay, and remember that there are those people who would really be willing to listen to you. Ayan, sir.
Okay, very well said. Okay, from Sir Freddy's Corner, or Sir Wilfredo Valois from the Literature Department, what to do when a colleague is reactive for every advice that you give?
Mm-hmm. Okay, ito lang medyo, I'll ask po on the context. So what do you mean by reactive?
Reactive?
If for example, this is parang more of defensive siguro, no? Parang galit dun sa mga advice. Yun po yung binabanggit ko kanina, no? Sometimes kasi it might be good to ask them first if they do need our advice. Okay? Kasi minsan nagiging reactive sila because yun nga, sometimes you just want someone to listen. Tapos kasi sometimes, diba, if you're not really parang asking for an advice, tapos of course, tayo naman, di ba, nagbibigay tayo ng advice kasi in the goodness of our hearts and our intentions, gusto nating makatulong, no? But there are some instances kasi the person may not really want to hear those advices. Kaya pag sinabi natin siya, ang dating sa kanila, parang inaatake sila. Okay? So, babalik sila na, they become reactive to the advice or parang nilalabanan nila or parang there are those people kasi na binibigyan mo ng solusyon but they find problems to the solutions. No? Yung mga ganong tao, minsan tayo rin nagkakaganan, di ba? So, in those instances, it might be good to ask them. I noticed na lahat ng sinasabi ko sa'yo, lahat ng tulong na sinusubukan kong ibigay sa'yo, parang hindi okay sa'yo. Ikaw ba, anong tingin mong, anong gusto mong gawin? Okay, you might want to bring back the question to them. Actually, kami sa practice namin as psychologists or counselors, no, ang parang sinasabi namin, mortal sin ang magbigay ng advice, kung tutuusin. So, our role is really not to give the advice, but to give help. So, if the person is becoming reactive in a sense, try to know then, no, bakit, ano ba yung kailangan nila sa atin? Baka kailangan lang nila ng makikinig. Kaya kahit anong advice mo, feeling nila ginajudge sila, feeling nila inaaway mo, pinapagalitan mo. So it might be good to take a step back and see what they need from us then. Ayan, sir.
Okay, thank you so much. From Sir Emerito Gonzalez, to whom or from whom do counselors unload or seek advice once they are negatively overloaded for their schoolwork or office? And I quote, inside parentheses, the barber cannot effectively cut his own hair. Diba? With 2 question marks.
Napangiti din ako kasi as a psychologist, this is really something that we've always been asked to. Dapat yata yung counselors natin yung sasagot na Ma'am Chat, Ma'am Angie, pasagot nito. Pero ako personally, as a psychologist, as a clinician, I also have my own therapist naman. No? I have my mentors who serve as my counselors, no? Na I talk to whenever I unload. My assistant has also been my parang naging ko na din siya, naging counselor ko na din siya kasi sometimes after a session with the patient, sometimes parang I unload lang, no, yung feelings, yung napag-usapan namin. And sometimes with one another, no, our counselors, yung ilan sa mga counselors natin sa university have been also parang talking to us, unloading lang din, no, or sometimes kami rin nagtutulungan. So, pero yes, it's okay then for counselors to reach out to other professionals, no. Pero yun, magandang tanong po yun, no, saan nga ba yung counselors natin nagsisik ng help? And dapat din, syempre, tulungan din natin sila, no. Yun din po, I think it's something that I'd like to point out, no. Sometimes pag kaming mga mental health professionals kasi may problema at nagsasabi sa ibang tao, lalo na yung mga non-psychologist, non-counselor friends namin, pag nag-open up kami sa kanila minsan, sasabihin, di ba psychologist ka, di ba guidance counselor ka, ba't hindi mo ma-handle yan, no? So if your counselors lumapit sa inyong mga faculty members na hindi counselors, na hindi behavioral science, hindi psychologist, minsan po kailangan lang namin ng kaibigan na makikinig. So kung yung counselor namin actually are our friends. So if our counselors, yung mga magagandang counselors natin, ask you for help, minsan kailangan lang po namin ng kaibigan. Okay na yun, may kaibigan kaming makikinig. Ayan.
Okay. Which is very interesting. Dapat ang counselors maganda at pogi.
Hindi naman yata, sir.
Okay. Sir, Dr. Jovi Jim Sanchez Aguas again. How can we convince our administrators to focus also on our well-being or mental health instead of focusing on accreditation and analytics, which adds more pressure and stress on us during this time of pandemic?
Mm-hmm. Ang hirap pong sagutin ito without without me unloading my frustrations. Pero paano ba? Let me take an example on sa companies kasi, no, we've been working with a lot of companies on how we encourage yung mga management, no, to promote mental health. Our administrators kasi are always in the thinking, sorry, no, if I'll be saying this out loud, not just in the university but many businesses, no, many institutions, the institution is still a business. It's always about money. Okay. So we always target that. No? When we're presenting and talking about mental health, we talk about money to them. Okay. When we talk about mental health, in the global economy, mental health actually leads to at least $1 trillion annually in lost productivity. And if you put that in the academe, okay, mental health concerns could lead to lesser research outputs. It could lead to poor teaching skills. Okay. Kasi ang teacher kapag yan may problema sa bahay, may problema sa asawa niya o sa anak niya, emotionally they're not okay, makikita yan sa pagtuturo niya. Okay? Estudyante yung kawawa. Okay? Whether mapapagalitan yung mga bata or hindi yan makakapagturo ng maayos. Okay? And other things that they need to provide us, yung outputs na kailangan gawin. We're talking about accreditation, for example. Okay? Kung ang isang faculty member is not emotionally well, hindi yan makakagawa ng magandang mga write-ups, for example, na kailangan natin sa accreditation. Okay? Yung quality na tinatawag natin ng educational services natin, lalabas at lalabas yan. No? So, talk about those. Okay? Tell them how a lot of our productivity can be affected if we do not care of the mental health of our students. Okay? Of our students and our faculty. Okay? So, ang investment, no, when we market this to companies, what we always say, 1 peso investment on mental health in terms of prevention can lead to 4 pesos of return, okay, in terms of productivity. So if you put that in the educational setting, imagine, no, if you're taking care of the mental health of the faculty members, magiging maayos yan. Kahit bigyan mo yan ng mabigat na trabaho, because they are of good mental health, productive sila. Okay? And they know that what they're doing is for the benefit not just of themselves, but also of the community. Okay, so research man yan, academic outputs man yan, when you are of good mental health, you see that this could contribute to a larger scheme of things. So kami usually yan, we benchmark on that, we bank on that, sorry. We bank on that in saying that you want to improve the quality of education, gusto mo maging kilala tayong university, mag-rank 1 tayo, top 1 tayo sa universities, take care of the mental health of the faculty and everything else would follow. Okay, ang example ko dyan lagi, yung UBC, no? Hindi ko na ba manggitin sinong admin ang kausap ko, but I told them about this. Okay, UBC invests 2.5 million Canadian dollars in mental health. Ang tanong ko sa kanila, that's a big amount of money. Why do you invest so much in the mental health of your faculty and employees? Ang sagot nila sa akin, because our board believes that more tuition money will be lost if we do not care of the mental health of students and faculty, which is true. Mas mahal po ang therapy kaysa sa prevention. Okay? Kung binibigyan natin ng faculty natin ng wellness breaks, kung binibigyan natin ng faculty natin ng time for themselves, again, workload is a very big issue. Bawasan ang workload ng faculty member into something that is manageable. Okay? Sorry, I keep comparing with other institutions. There are institutions that their faculty members are teaching 12 units. They're still being paid for a full 24 units. The rest of the time is used for yung accreditation work nila, okay, research work nila, and many other things. Tayo sa UST, when I was still part of UST, you're paid for 24 units or 21 or 18 units and you're working for all of those units. Ang accreditation work natin labas dyan. Okay? Which of course puts more stress, and ang magsasuffer dyan, either yung accreditation work mo or yung teaching mo. Okay? Instead na makapagturo ka ng maayos, ginagawa mo yung paperworks mo. So, apektado yung students. Apektado image ng university pagdating doon. So, we have to make sure that, remember, mental health is not just about being happy. It encompasses many different things. Kasama po yan yung work, policies, and many different things. No? So, encourage the university by telling them that if we take care of our faculty members' mental health, yung teaching niyan gaganda, yung services na pinoprovide nila gaganda, at makikita yan ng estudyante. Sorry, UST has been bashed when it comes to how we take care of our mental health, whether students and or faculty. And that affects our ranking. So if you want to improve our university's image, take care of your faculty's mental health. Pag gumanda ang work environment natin, lahat po yan sasama. Relationships, quality ng work, accreditation, sunod-sunod po yan. So bank on that, iharap nyo po yun sa kanila para malaman po nila yan. And truthfully, when I was asked by one top-level admin, bakit kailangan natin yan? Wala namang nababaliw sa mga estudyante natin. Bakit kailangan natin ng mental health services? And we've been having suicide cases at that time. Okay? Doon ko po sinabi, how many more dead bodies do we need to give you just for you to act on this? So if we have to be that frank, be direct to them. And sorry, confident ako sabihin ito kasi I'm not with USC anymore, but please, we need to do that. Not to attack the administration, but really to make them realize na kailangan din. Hindi lang yan naman para sa atin, para din naman po sa kanila yan. Ayan, I'll stop. Baka ano pang masabi ko.
Okay, but very, very honest answers. That's Sir Renz, and I like that. Very, very, very nice. Okay, from Sir Jerry Banzon, would you advise resilience as a solution to a mental health issue? from the Legal Management Department.
Mhm. Resilience, Sir Jerry, no, is actually one of the things, a protective factor ang tawag natin siya dyan, no? It's a protective factor in a sense that it makes sure that, kasi resilience is how we parang bounce back from problems, so in simple terms. So when we build on the resilience of our people, when we build on the resilience of the faculty, of our students, protective siya in a sense na mas makakayanan nating i-handle yung problem. So if you can have also webinars on how to build resilience, maganda rin pong topic yun. So yes, that's one good approach po to deal also with mental health concerns.
Very good. And that's another topic possible, and we're going to invite on that topic. Okay. And for our last question, because we're running out of time, I know there will be lots of questions there, but you can email Sir Renz later on for that question. From Annalisa Yanga, is giving money and effective support help to someone who is not in a normal situation or condition?
Ano ba to? Depende ho kasi. Giving money can be a form of practical support. No? If we know, for example, yun nga, kung may problem siya at alam natin na medyo apektado na yung finances, that might be a good way to help them on the practical side of things. Okay? Pero, pupunta tayo dun sa usual expression, di ba, na give a man a fish, you feed them for a meal or a time. But if you teach them how to fish, you feed them for a lifetime in a sense. So, ganun din po. No? If kailangan ng person yung pera ngayon kasi malaking bagay yun na nakaka-apekto sa stress niya, okay lang. Okay? Pero kailangan i-emphasize natin yung other areas of support. Okay? Kung paano siya, for example, kung problema niya yung pera, okay? At nawalan siya ng trabaho, pwede natin siyang tulungan ng financially muna para ma-address ang immediate concerns. Pero encourage them then and, assist them on how they could find a job or encourage them to look for a job in other areas. No? So, ano po siya very tricky in a sense na to a certain extent, okay lang. But in many instances, hindi din maganda kasi it might lead also na parang isipin niya na, okay, pag may problema pala ako, kailangan ko ng pera, I can get money naman. So, importante din na itulungan natin sila na matuto on how they could also parang stand on their own. Ayan.
Okay, well said. Let's all give a round of applause to Sir Renz.
Thank you, sir.
Very, very honestly and with heartfelt. Thank you so much for that, Sir Renz. But before I will let you go, I want you to say last words for our faculty members listening right now, and even to our guests, those who are viewing us live via YouTube and, of course, our FB page. Last words, sir.
Yeah. Kasi we're talking about ngayon and helping others and supporting others. This is something that I've been really asking for everyone. Let's provide safe spaces for discussions. Whatever yan, mental health man yan, issues man yan ng labor-related or many other things. Let's offer and open safe spaces to discuss, to talk about things nang hindi tayo parang laging nang aaway, laging galit, no? The only best way for us to make this world a better place is when we start to become good and kind to one another. So yun lang po siguro yung iiwan ko for you this morning. Let's be kind to one another. Marami na tayong pinagdadaan ng problema. So wag na tayong dumagdag sa isa't isa, di ba? And thank you so much again, Alpha, for inviting me and also to our counselors.
I like that. Very timely. I like that. Very timely. Okay, so on behalf of the organizing committee, I would like to invite all of you for the last day of this webinar series on September 19. Mark your calendar, titled You Matter. The last session will be facilitated by our very own Counseling and Career Center staff. Okay, I have heard they prepared activities and workshops for all of those who will join this last part of our 3-day seminar series. On behalf of the Officers of Arts and Letters Faculty Association, I would like to say thank you so much for your time. Those who registered, you will be given the link for the evaluation through your email. Be mindful in writing your complete name, for after submitting your evaluation sheet, your certificate of participation will be mailed to you in real time. So careful with spelling and capitalization for that matter. So today I learned a lot about my role as an educator and my role as a support individual for the well-being of the people around me. I thank you so much, Sir Renz, very young, very handsome, and very articulate speaker for the day, for his invaluable insights on this very timely topic. Again, I am Assistant Professor Emil Sarmago, Public Relations Officer of ALFA, your moderator of the day, saying Thank you so much for being part of this fruitful event. To formally end today's event, please stand and join me in the singing of the UST hymn.
Spirit.